Hello everybody, and welcome to our wonderful workshop on the most amazing organ in your body, your heart. We're going to talk today on how to keep it beating. So my name is Valerie, and I am going to be your workshop teacher today, and I'm very happy to be here, and hopefully we can all learn something about ourselves and each other and realize just how important our heart is. Okay, we're going to start off today with a little thinking exercise. I want you to just maybe close your eyes, or you can keep them open, but I want you to just think about the answers to these questions I'm going to ask you. Answer them in your mind. I want you to answer them truthfully, and you don't have to say them out loud, but just think of your answers as we go through the questions. Okay, the questions are, do you feel healthy today? Do you think you eat healthy? Do you exercise regularly, which is 3+ times a week would be considered regularly? Have you gained weight in the past few years? Have you been diagnosed with diabetes? Do you suffer from anxiety and/or depression? Okay, think about those questions and your answers to them as we talk about our hearts today, and I want you to just really focus on yourself and maybe those that you love. Okay, the American Heart Association recommends focusing on heart disease prevention early in life. To start, assess your risk factors and work to keep them low. The sooner you identify and manage your risk factors, the better your chances of leading a heart-healthy life. So, knowledge is power. I need you to understand the risks you face for your heart attack. Extensive research has identified factors that increase a person's risk for coronary heart disease in general and heart attack in particular. The more risk factors you have and the greater degree of each risk factor, the higher your chance of developing coronary heart disease, which is a common term for the buildup of plaque in the heart's arteries, and thus could lead to a heart attack. So, risk factors fall into 3 broad categories. And these risk factors are, number 1, major risk factors, number 2, modifiable risk factors, and number 3, contributing risk factors. We are going to talk about these 3 categories and go through them. Major risk factors. These are risk factors that cannot be changed. You may be born with certain risk factors that cannot be changed. The more of these risk factors you have, the greater your chance of developing coronary heart disease. Since you can't do anything about these risk factors, it's even more important that you manage your risk factors that can be changed. So some of the major risk factors: increasing age. The majority of people who die of coronary heart disease are 65 or older. While heart attacks can strike people of both sexes in old age, women are at a greater risk of dying. Male gender. Men have a greater risk of heart attack than women do, and men tend to have attacks earlier in life. Even after women reach the age of menopause, when women's death rate from heart disease increases, women's risk for heart attack is less than that for men. So, men have them more often, women more often die. Heredity, including race. Children of parents with heart disease are more likely to develop heart disease themselves. African Americans have more severe high blood pressure than Caucasians and a higher risk of heart disease. Heart disease risk is also higher among Mexican Americans, American Indians, Native Hawaiians, and some Asian Americans. This is partly due to higher rates of obesity and diabetes. Most people with significant family history of heart disease have one or more of these other risk factors. Just as you can't control your age, sex, and race, you can't control your family history, so it's even more important to treat and control any other modifiable risk factors you have. We're now going to talk about those modifiable risk factors. They're still major risk factors, but they are things that can be changed. You can treat them or control them. Number 1, smoking. The risk that smokers will develop coronary heart disease is much higher than that for non-smokers. Cigarette smoking is a powerful independent risk factor for sudden cardiac death in patients with coronary heart disease. It also interacts with other risk factors that greatly increase the risk for coronary heart disease. High blood cholesterol. As your blood cholesterol rises, so does your risk of coronary heart disease. When other risk factors, such as high blood pressure and tobacco smoke, are also present, the risk increases even more. A person's cholesterol level is also affected by age, sex, heredity, and diet. High blood pressure. High blood pressure increases the heart's workload, causing the heart muscle to thicken and become stiffer. The stiffening of the heart muscle is not normal and causes the heart to function abnormally. It also increases your risk of stroke, heart attack, kidney failure, and congestive heart failure. When high blood pressure is present alongside obesity, smoking, high blood cholesterol levels, or diabetes, the risk of heart attack or stroke increases even more. Physical inactivity. An inactive lifestyle is a risk factor for coronary heart disease. Regular, moderate to vigorous physical activity helps reduce the risk of cardiovascular disease. Physical activity can help control blood pressure, diabetes, and obesity. It can also help to lower blood pressure in some people. And obesity and being overweight. People who have excess body fat, especially if a lot of it is at the waist, are more likely to develop heart disease and stroke, even if those same people have no other risk factors. Many people may have difficulty losing weight, but for those above a healthy weight, sustained weight loss of 3 to 5% of your body weight may lead to significant reductions in some risk factors. Greater sustained weight losses can improve blood pressure, cholesterol, and blood glucose. Diabetes. Diabetes seriously increases your risk of developing cardiovascular disease. Even when your glucose levels are under control, diabetes increases the risk of heart disease and stroke. The risks are even greater if blood sugar is not well controlled. At least 68% of people with diabetes over 65 years of age die of some form of heart disease. It's a pretty staggering factor. All right, let's move on to our other contributing factors. These factors also contribute to heart disease, to your risk of heart disease. Stress. Individual response to stress may be a contributing factor for heart attacks. Some scientists have noticed a relationship between coronary heart disease risk and stress in a person's life, along with their health behaviors and socioeconomic status. These factors may affect other established risk factors. For example, people who are under stress may overeat or start smoking or smoke more than they otherwise would. Alcohol. Drinking too much alcohol can raise your blood pressure and increase your risk for cardiomyopathy, stroke, cancer, and other diseases. It can also contribute to high triglycerides and produce irregular heartbeats. All that said, there is actually a protective benefit to moderate alcohol consumption. It is not recommended that non-drinkers start using alcohol or that drinkers increase the amount they drink, however. Diet and nutrition. A healthy diet is one of the best weapons you have to fight cardiovascular disease. What you eat and how much can affect your controllable risk factors, such as cholesterol, blood pressure, and diabetes, and being overweight. To maintain a healthy weight, coordinate your diet with your physical activity level so you're using up as many calories as you take in. Reducing your risk starts with smart choices. So, some of these choices we're going to talk about. If you smoke, stop. Work with your doctor to manage your other risk factors, including high blood pressure, high cholesterol, and diabetes. An active lifestyle and good nutrition have also been shown to be helpful in preventing heart attack, as we said. And I'm now going to show you an animation of a heart attack, just so you all can see exactly what it does to your heart when you have a heart attack. The heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or stopped. If the plaque breaks open and a blood clot forms, that blocks the blood flow. A heart attack occurs. This is showing the coronary arteries that supply blood and oxygen to the muscles of the heart. This happens because coronary arteries that supply the heart with blood can slowly become thicker and harder from a buildup of fat, cholesterol, and other substances called plaque. This slow process is also known as atherosclerosis. It's kind of a crazy word. It just shows that if the plaque becomes unstable and ruptures, the clotting process, called thrombosis, starts inside the artery. It starts to clot. Thrombosis continues, blood supply to the heart muscle is reduced, and muscle tissue can start to actually die as this blood clot gets bigger. And then you have a heart attack. If the clot completely blocks the coronary artery, all muscle tissue below the blockage can die. So I'm hoping today you learned a little bit more about how you can prevent heart attack and also how you can keep your heart healthy. If you have any questions, please refer to the handout that you will be receiving that gives you some extra tips on how to help keep your heart healthy. And we hope to see you at our next workshop. Thanks so much.